Hi guys, welcome back to my channel. Today we will be working with the COVID-19 terminology and pronunciation. Don't forget to subscribe and hit the like button. Asymptomatic, presenting no symptoms of disease. Case fatality rate, the ratio of deaths from COVID-19 to the total number of individuals diagnosed with the disease. Clinical trial, research experiments on human participants designed to answer questions about new treatments. Community spread, the spread of a contagious disease in a geographic area in which there is no knowledge of how someone contracted the disease. Contact tracing, identifying and monitoring people who may have come into contact with an infectious person. Coronaviruses, also known as COVID, is typically spread between animals and humans, an event known as zoonotic transfer, and they are named for the term corona, Latin for crown, which refers to the shape of the virus when observed microscopically. Epidemic, a widespread occurrence of an infectious disease in a community or geographic area. Epidemiology, a branch of medicine which deals largely with public health, including the incidence, distribution, analysis, and control of diseases. Flattening the curve, an attempt to create a more gradual uptick of cases rather than a steep rise in an effort to avoid overburdening the healthcare system all at once. Immunosuppressed, an individual who experiences reduced efficiency of the immune system as a result of health conditions not related to COVID-19 disease. Incubation period, the time between when an individual is first exposed to the virus and the appearance of symptoms. Lockdown, an emergency measure in which individuals are restricted from certain areas in an attempt to control exposure or transmission of disease. In a lockdown during an epidemic, individuals are encouraged to stay at home. Pandemic, a worldwide spread of an infectious disease with a larger reach than an epidemic. Person-to-person transmission, when a virus is spread between people, including physical contact or coughing and sneezing. PPE, personal protective equipment, or PPE, is specialized clothing and equipment used as a safeguard against health hazards, including exposure to infectious diseases through physical contact or airborne particles. Screening, the act of verifying symptoms and potential exposure before testing for the virus. Self-isolation, the act of separating oneself from others. Self-quarantine, the act of refraining from any contact with other individuals for a period of time, in the case of COVID-19, 2 weeks, to observe whether any symptoms of the disease will arise after potential exposure. Social distancing, the act of remaining physically apart in an effort to stem transmission of COVID-19. Social distancing can include a move to remote work, the cancellation of events, and remaining at least 6 feet away from other individuals. Symptomatic, showing symptoms of COVID-19 which can include a fever, dry cough, shortness of breath, and body aches. Vaccine, a biological preparation of organisms that provide immunity to a particular infectious disease. Currently, there is no vaccine for COVID-19. Ventilator, a machine designed to move air in and out of the lungs for a patient who is physically unable to breathe or who is not breathing well. Because COVID-19 can cause severe lower respiratory infection, ventilators are critical machines for patients with severe disease. I hope this helped, guys. Remember to practice your reading and pronunciation in order to improve your proficiency. Don't forget to subscribe and like to get notifications. Bye.